spending over a decade training to save lives, only to feel like you're working in a system that slowly destroys your own. So much so that some physicians are asking a shocking question. Has medicine become less viable than other professions like sex work? My name is Dr. Aisha Rush, and welcome to episode 2 of Informed and Unfiltered, where we discuss the real truth about medicine. I know what I just said sounds crazy and quite radical. Medicine is often looked at as one of the most noble professions in the world. The profession is often highly respected, and people still actually look up to physicians. But this system that we as doctors work in is not noble. It's a for-profit system that does not look out for the best interests of patients all the time. The financial bottom line is more important. We as physicians work in this system and are often eaten up by it too. Our hands in many cases are tied. Many of us are employed by big conglomerates and have to play by their rules. We often have to say, what do? We have no say in what really happens to our patients as they churn their way through such a convoluted and ridiculously complicated system. So what does this look like if we as physicians are being truly honest? Well, Dr. Corina Fratilla, an endocrinologist, gives her honest opinion of what her experiences have been in her article titled, "Why Does Sex Work Seem Like a More Viable Path Than Medicine in 2026?" Wow. The article was written on the website KevinMD.com on March 6, 2026, for those who want to research it. This article was actually sent to me by a friend and colleague, and we too have had similar experiences, and personally, I know for sure I have. So let's get into the article. I'm actually going to read the article all the way through because I think it's important to really capture everything Dr. Fratilla is trying to say. So here we go. She starts out, "Let me be clear. This is not a whimsical, maybe I will pivot into OnlyFans moment. I am 53 years old. I am menopausal. My libido is in witness protection. The bloom is not just off the rose. The whole damn bush was yanked out and replaced with the xeriscape of dried sarcasm and silent screams. But I swear to God, if sex work was a viable option for me, I would drop my stethoscope faster than Big Pharma drops accountability. Let us compare, shall we? The American healthcare system. You train for 12 to 15 years, rack up $300,000 plus in debt, and enter the field with the naive fire of someone who thinks they are joining the Avengers of Healing. Then you realize you are just a glorified data entry monkey in a Kafkaesque insurance labyrinth. I can't get that word out, but I'm sure if you guys read it, somebody correct me. Legally obligated to spend more time clicking boxes in Epic than making eye contact with another human. Every day feels like a hostage negotiation between your soul and your malpractice insurance. If your patient dies, it's your fault. If they live but post a bad Yelp review, it is also your fault. You have to beg insurance companies for permission to provide life-saving treatments as if you are a child asking for an allowance. Your bathroom breaks are timed. Your sanity is optional. Sex work. She gets into that. So she says, clients pay you directly, like a sane business model. You set your own hours. If you're tired, you don't just hold your pee for 9 hours and code strokes with one hand. No one pages you at 2:00 a.m. because someone's penis hurt from watching YouTube on the toilet too long. There is more consent in a single OnlyFans DM than in the average hospital board meeting. That's so true. You might fake an orgasm, but you don't have to fake belief in a value-based care model designed by people who have never touched a patient. A day in the life. Being a doctor used to mean something. Now it means you spend 50% of your time documenting symptoms that don't matter, so an algorithm doesn't flag you as non-compliant, and 50% explaining to a middle manager why saving someone's life doesn't meet metrics. Let us be real. We are not burned out. We are being gaslit, or we have been gaslit. Burnout implies we could not hack it. Oh, honey, we hacked it. We did residency on 3 hours of sleep a night while being verbally abused. This is not burnout. This is moral injury. The system has become so ethically bankrupt that staying in it feels like spiritual self-harm. And no, I am not romanticizing sex work. I know it is hard. I know it comes with exploitation, stigma, risk. But at least it does not gaslight you into thinking you are the problem for being traumatized by the trauma factory you work in. At least sex work doesn't require you to kill parts of your soul just to comply with ICD-10 coding. At least in sex work, when someone screws you, it is consensual. But you are a doctor, yes. And I have been a therapist, a social worker, a tech support agent for malfunctioning e-prescribing systems, a hostage prior to prior authorizations, and a sacrificial lamb to every budget cut. I got a full body rash once from the stress of explaining to a Harvard MBA why giving insulin to a diabetic and DKA might be cost effective. I would rather do sex work. She says, final diagnosis. This system isn't broken. It is working exactly as designed, for profit, not for people. And I am done pretending this is noble. I am done being complicit. If I had the knees and the skin of a 24-year-old dominatrix, I would be cracking whips in a leather catsuit rather than charting on a system that crashes every 20 minutes. Instead, I write and I rage, and maybe, just maybe, I help tear the whole thing down and rebuild something that doesn't make healers wish they were hookers. Because trust me, if you are a doctor in America right now, you know the truth. That is the end of her article, and it is quite powerful. I wanted to bring this article to this podcast because I don't know how many times I have had the conversation about this very thing, about us being caught up in this crazy system. Our professions are not what they used to be. We do not have autonomy. We significantly lack any sense of autonomy to ourselves, our patients. We cannot make decisions without somebody looking over our shoulders, making sure that we hit a metric, making sure that it's cost effective, making sure, that this does not cost the hospital or the organization this amount of money. And if it does, we need to order a different kind of test. Oh, and the insurance companies, that's a whole nother ball of wax in terms of, the patient can't have this medication. They need to fail all of these other medications first because you are wanting to give them something that you know will work, but they have to go and jump through all of these hoops as well as you doing prior authorizations, et cetera, in order for a patient to either get a life-saving surgery or a life-saving medication. It is a racket, and it is unbelievable. There are so many days where I have sat and spoken with my colleagues about this system. Everyone knows that it's broken. And we sincerely just have come to a point where we don't know what else to do. And as she said, I vent, I rage, because sometimes that's all you can do. When we as physicians started to become so overwhelmed by this process, by this system, many of us came out of those boardrooms. Many of us came out of those organizations as people of leadership. And so now you have people that have MBAs that have no idea what medicine really looks like, crunching numbers and making decisions for patients that make absolutely no sense. We have become so jaded in some cases by all of the things that we've gone through. It is overwhelming and insane. And as she spoke about, we've gone through residency, and she is absolutely right. Working on 3 hours of sleep. I remember the days before we got to this 80-hour work week deal where the residents are, they can only work 80 hours, and God forbid they work 81. Now the ACGME is called and the program is on probation. Oh, honey, there used to be a time where if you call the ACGME, you knew that if your program was on probation, you didn't want that because you didn't want to be in a program that was on probation. We thought about things like that. Oh no, the new residents, they will call the ACGME in a moment, and they could care whether or not their program closes because they feel like, oh, we'll just go to another one. There is no sense of consequence, but us people that are becoming dinosaurs now, we are these people that really cared about our training. And if your attending corrected you, or I had an attending that yelled at me all the way down the hall, the length of almost half of a football field, because she felt like I didn't do the right thing. And you know what I had to do? I had to sit there and take it. But those were the lessons that we learned, and it made us want to become better doctors, good doctors. It made us want to not know things. We wanted to know everything that we needed to know to make sure we cared for the patient. We trained, we sacrificed. Many of us sacrificed not only our time, our families, our energy, just to come into a system that is now so broken. Many of us are leaving as fast as we even get residents to come through. It is insane. So let's really break down this article, shall we? And talk about some of the specifics of this article. Let's take a moment. So first things first, when a physician says something this extreme, we should truly pay close attention. So let's start with what I think the core of this article is about: being gaslit. Making us physicians and other healthcare workers, including NPs, PAs, and nurses, believe this false narrative that we're burned out, which suggests weakness, like we can't deal with normal life and or work stressors. This is simply not true. This isn't burnout. This is what happens when your values and your environment are in constant conflict. The article explicitly states physicians feel gaslit, not burned out. And from a personal perspective, I know this to be so true. There's one thing Oprah once said, and that was, when people show you who they are, believe them. We throw this saying around so flippantly, but I found time and time again it to be so very true. The system is a pimp. So in essence, it's almost like we're already doing sex work without the sex part. The system, from the insurance companies to the organizations we work for, are really pimping all of us, including the healthcare worker and the patient too. My friends and I often joke about when we have to go to work and say, girl, let me go and get on this post so I can pay these bills. While we joke about that, I was in awe that someone too believed and had the same mindset as us, which means this is not at all isolated. The feeling is mutual and very real. But as healthcare workers, we're committed to our patients. We are committed to the oath of to do no harm and to make sure as much as we can that each patient is treated individually with care and, most of all, putting them first. Many of us on many occasions have risked life, limb, family, and even our jobs to make sure we do the right thing by each and every one of our patients, despite what consequences we could potentially face. That's what makes us the professionals we are, the caring and compassionate people we strive to be. Because in our world, despite it all, the patient is first. But the red tape, it wears us down, making us not want to go the extra mile because of what it may cost us, not wanting to go the extra mile because if you complain about patient safety or things that are happening that could cause harm to patients or the organization, you'll be looked at as a troublemaker, a loudmouth, a problem, a pariah. If you don't go with the status quo, you're not a team player. It becomes you against your organization, when in fact, you are simply trying to save the organization from that multi-million-dollar lawsuit. Now, let's get into another part of the article that's quite important: the administrative burden this system places on the healthcare worker. From a physician perspective, we are slaves to the EMR, the electronic medical record. God help us all. We spend more time charting and billing than we do in patient contact. Making sure we chart to meet metrics, to provide explanations for insurance billing, and to make sure we don't get sued. We have to chart specifically for insurance companies so patients can be approved for medications and procedures they absolutely need and require. Oh, the prior authorizations are absolutely deadly. I used to have a nurse specific for just this task. Ridiculous. Then the insurance company still denies it several times and try to wear you down. You eventually have to fill these forms out on average 3 to 4 times before you actually wear the insurance down. It's unbelievable. The man hours this takes is unspeakable. The time you spend doing this leads to less time with patients, listening to them, trying to understand what their needs are, and just simply treating the patient. Oh, and let's not get into the number of patients you're required to see on a day-to-day basis for the organization to make money. 30 to 40 patients is often required. Please tell me how it is at all possible to see this number of patients in an 8-hour period. This often leads to you holding your pee the entire office hour session, not eating lunch, or even drinking water for that matter. I'm surprised that some physicians haven't just dropped dead on the job. We talk to our patients about healthy habits, but we are often less than the beacons of health ourselves because we literally have no time to be. Then we have the loss of autonomy. Not truly having a say in how we treat patients. The organizations and insurance companies really carry the power. Or better yet, we don't even have autonomy in our own lives when it comes to our workplace environment. And please don't complain about not getting a lunch break. Who needs to eat anyway? That's not important. It really comes down to this. You're no longer practicing medicine. You're negotiating permission in everything you do. And then we get to the blame culture. As mentioned in the article, and this is so very true, if there is a bad outcome, it's the physician's fault. If the patient complains, it's still the physician's fault. And some of the complaints that patients have, such as wait times, not getting their prescriptions on time, or having to come back for follow-up visits, have nothing to do with the physician at all. Follow-up visits are sometimes built into the system and sometimes are required for certain things to get covered by the insurance company. And God forbid you don't have someone come in for that follow-up visit and they have an adverse outcome. This can definitely turn into a case of negligence, which opens the door to medical board actions and lawsuits, just to name a couple of the consequences. I don't know how many times I've heard patients say, oh, my doctor wanted me to come back for so many follow-up visits because he wanted to buy a new boat. If patients really knew what insurance reimbursements were, they would balk at such a measly amount. Plus, this money doesn't go to the physician. It actually goes to the organization. As physicians, we are often paid one salary, no matter how many patients we see, $5,200. So for many patients who believe we just want to get a new boat, no, so not true. Some of us are trying to afford the same things you are, like food, mortgage, transportation, maybe tuition for one of our kids or two. All of these things are not to mention simply dehumanizing. No autonomy, no control over our schedules, no freedom from bureaucracy. But sex work, on the other hand, as Dr. Fertitta put it, you get direct pay, you get control over your schedule, there's a clear transactional model. But as Dr. Fertitta so eloquently put it, the system is not failing. It is working exactly as designed. Healthcare prioritizes profit over people. The system isn't broken. It's functioning in a way that no longer aligns with the mission of medicine. And let's be clear here. All of this takes an emotional toll, especially when you've taken an oath. Your expertise and your many years of education don't matter. You're undervalued, not only as a physician with your vast knowledge base, but as a person. No one cares about the burden, pressure, and emotional toll the system has on the healthcare workers. Who are we anyway? Well, only just the people that actually make something so broken actually kind of work. We make the system look like something other than what it actually is. It's a machine, but we make it look pretty with the bow and all of the fixings. So the big questions are, when did medicine stop being about patients? Why are physicians leaving medicine? What does it say about a system where doctors feel trapped? This isn't burnout. It's moral injury. Doctors aren't tired. They're disillusioned. Medicine doesn't lack talent. It lacks alignment. The issue isn't the work. It's the system around it. Autonomy in medicine is disappearing. This conversation isn't about comparing professions, especially when it comes to physicians and sex work. That was just a play on things, but I like how Dr. Fertitta put that because it sometimes feels so real in that way. But it's about asking deeper questions. What has medicine become? And what does it need to be again? I hope this was a stimulating discussion and one that I hope many of you will take to your boardrooms and many of you will take to your organizations, and a discussion that we will likely have in many, many more podcasts to come, because it is so very important. There are so many elements here that we need to just tease out, simply for the sake of our patients and the sake of everyone's sanity, including our own. I'm Dr. Aisha Rush, and this is Informed and Unfiltered. Thank you for listening. Please like and subscribe on our YouTube channel. You can also find us on Apple Podcasts, Spotify, Podbean, iHeartRadio, and Amazon Music. You can also find specific obstetrics and gynecology topics on my personal YouTube channel under Dr. Aisha Rush. See you next week, where we will be discussing yet another compelling topic, and maybe we will reach out to Dr. Fertitta to have her give us her personal perspective on a future podcast. See you all soon.